was a midwife for 40 years. I started in Manchester on a bike, like Call the Midwife, for a year. And I have been to various hospitals in the area. And I am horrified to find out that none of the midwives here today are allowed to wear their uniforms or are allowed to say which trust they work for because they have been frightened by management. This is outrageous. These girls should be proud enough to say where they work and say what the conditions are where they work. Things were getting bad when I left in 2004. I've kept in contact with my professional colleagues and my heart bleeds for you. For goodness sake, which other profession isn't allowed to go and have a wee while you're working? Who isn't allowed to drink a cup of tea? Who isn't allowed to have a drink of water? It is outrageous. These are the conditions this professional body are having to work under, and it is atrocious. Please support this cause. Midwifery is in crisis.
We are currently facing a massive midwife shortage. The delivery suite where I work is supposed to have 8 registered midwives on duty overnight, but frequently has to cope with only 5. This is the same in hospitals across the country. Unlike in other parts of the health service, you can't slow admissions or postpone operations to cope with the pressure when it comes to childbirth. No expectant mother can be told that they will have to come back another day. No one can have their surgery delayed, and this has inevitable consequences on the services we offer. A fundamental tenet of caring for women in labour is one-to-one care. This means a labouring woman is cared for by a single midwife assigned to her and her only. But at that moment, midwives are often forced to divide their time between 2 or even 3 women giving birth. And here's where it gets hard. Work on a maternity ward is demanding and requires a team effort. When there are plenty of people around to help, there is a collaborative effort that makes the delivery easier. But when there is a staff shortage, say one midwife is missing from a team that usually includes 8, there isn't just an 8th work more to do. Everyone has an awful lot harder to cope. And when a midwife is split between 2 women giving birth, then there is twice as much to do and twice as much paperwork.
Like you, not only fighting today for a public health service, but fighting a long-term battle because the Tory government for the last 10 years has done what Tory governments always do, try and cut the health service by cutting spending on health. Every year that they've been in power for the last 10 years, they've cut and cut and cut services, and then they've given really abysmal levels of training so that the next generation of workers are not there to take our places in our vital jobs in the health service. And they're privatised services, and privatised services don't invest in training. They leave that expensive job of training the next generation to the public sector. But more and more of the health service is being privatised, so there are fewer and fewer opportunities for training for the staff of the health service.
What I want the government to do today is to listen to what people are saying and to admit that the health service is not the great service it used to be, but it is in crisis. If they don't admit that, they will never start to put it right. It is in crisis and it needs money and it needs a different sort of health service. We've had privatisation. 20% of NHS funding is wasted on privatisation, on paying the profiteers, but also on the billing and the contracting and the selling and all the other nonsense. Take that out and we would have lots more money. But they also waste it on private companies and on their mates. Test and trace, £37 billion on a system that didn't work, that would pay every single health worker a 15% pay rise for the next 7.5 years, and yet they tell us they can't afford more than 3%. I think health workers have had enough. And when MPs tell us that they need a second job in order to keep themselves going because the 82,000 minimum they get isn't enough, I know that every single health worker works 2 jobs every day they go into work, but one of them they get paid for and one of them they do for this country? Well, I tell you, you don't compete with a migrant for a bed. What you do, you're more likely to be treated by a migrant worker than you are to be competing for a bed with them. We should welcome migrant workers into this country. They've helped to make our NHS, they've helped to sustain our NHS, and we need to fight together with them in order to say we will not let people be scapegoated.
You're with us at our happiest moments and sometimes our saddest moments in birthing our children. We rely on your skills, your empathy, your compassion, your humour, your kindness to help us have safe, healthy births. But you cannot support us if you are not supported. You cannot show us respect and care if you are not respected and cared for at work. You can't give us strength if you are tired, exhausted, if there's a lack of staff, resources, time, if you aren't paid enough and you work too many hours. You can't go on giving when you're empty. The pandemic has made your job harder and you haven't been protected enough. But safe PPE has been trauma around more difficult births and lack of support, and it's all due to the government and employers. The hasn't created the crisis, but it's made it a lot worse. We fear you're pushed to the limits of endurance and beyond. You're exhausted and burned out, exploited, uncared for, and your skills are not respected. Many of you are traumatised and may be suffering from PTSD. We feel for you, we care for you, and we are bloody furious at your treatment. It's not up to you to self-care. It's up to the government employers to treat you properly. We support your demands and your fight for better. For more staff, more resources, more support, better pay, less hours and more respect. You're worth it, you deserve it now. All our love and support to all of you, and we are marching with the midwives.
What this pandemic taught us is that you are the most important people. You are the valuable people. You are the essential workers, along with social workers, carers, bus drivers, those wonderful Amazon delivery workers who we loved so much. And we got that sense of pride in one another. But since then, it's been very hard. And like you, I found a range of emotions of pride and joy, seeing essential workers looking after all of us and keeping us well and keeping us safe. But most of all, the emotion that I felt this week is anger. Seething anger. It makes you piss boil to see Boris Johnson on the telly. Sometimes you don't even want to switch the television on. And this week he said, don't judge a service by the amount of money that you spend. How dare he say don't judge by the amount of money that we spend? The outrage of the man. And what about when he told us in COVID, let the bodies pile up? How dare he speak like this about our brothers and our sisters and our aunts and our uncles and our neighbours? We have a justice minister who said, isn't misogyny terrible? It's so terrible whether it's against a man or whether it's against a woman. We are lions. We are lions led by donkeys. And it's time for them to go.
This has been a fantastic day. You guys are all amazing. Thank you so much for coming out. But unfortunately, this is probably going to just be the beginning, because we won't be listened to after one day of nationwide vigils. We're going to have to keep going until we get what we need and what we deserve and what makes things safe.